How long to wait after tracheostomy for hemorrhagic stroke? Today I want to talk about home care options for scenarios like this. So my name is Patrick Hutzel from intensivecareathome.com, where we provide tailor-made solutions for long-term intensive care patients predominantly at home, including 24/7 tracheostomy and ventilator care, all delivered by critical care nurses. Today I want to answer a question we get all the time. How long does it take for a hemorrhagic stroke patient to wake up after tracheostomy if they've already been weaned off the ventilator? Well, short answer is that it depends. So let me explain why. Hemorrhagic strokes by nature are severe and usually involve bleeding in the brain that creates massive pressure and damage. Recovery timelines vary wildly depending on location and size of the bleed, the degree of brain swelling and secondary brain injury, how quickly the bleeding was stopped, the level of oxygen deprivation, the patient's age, and pre-existing medical conditions. Sometimes patients may also have a craniectomy after a hemorrhagic stroke, which is a removal of parts of the skull of the head. And then, then after that, a cranioplasty might happen after the brain swelling has come down. So you have to consider that as well. Now, if your loved one in ICU already had a tracheostomy and has been successfully weaned off the ventilator, that's a very good sign overall. It means their respiratory drive is working. However, waking up in a meaningful way, not just opening eyes, can take weeks, months, or even longer. Many patients go through stages: coma, vegetative state, minimally conscious state, and then hopefully higher levels of consciousness. But here's when things get very tricky in ICU and hospitals. Once your loved one has a tracheostomy and is off the ventilator, hospitals and ICUs often want to discharge them fast, sometimes without proper neurological rehabilitation plans. In many cases, they get pushed to aged care facilities or nursing homes, which are completely inappropriate for someone who's still dependent on a tracheostomy and needs complex care. And you will also find that most aged care facilities or residential aged care facilities do not have the skills or personnel to look after tracheostomy. That's where we come in, because we offer a better alternative: ICU level care at home, instead of staying in ICU. At intensivecareathome.com, we are the only proven service in Australia that can provide 24/7 critical care nursing at home for patients with tracheostomies, ventilators, and other complex needs. This includes tracheostomy care, airway suctioning, peg feeding management, seizure management, neurological monitoring, ongoing support for patients with disorders of consciousness like post-stroke states. And also, if a patient, for example, needs airbow, cough assist machine, nebulizers, that's all part of what we do. All of our staff are critical care trained nurses with ICU experience. We don't use support workers for tracheostomy clients because it's unsafe and it violates not only NDIS rules, it also violates evidence-based guidelines for home mechanical ventilation and tracheostomy that you can find on our website under the Mechanical Home Ventilation Guidelines. Yes, if your loved one is under NDIS, and keep in mind that a stroke is an NDIS-funded diagnosis because it's a disability, we can help you with getting the appropriate funding for 24/7 nursing care at home so that your family member can leave hospital with tracheostomy. Most families don't even know this is possible, but we've done it many times. We liaise directly with support coordinators from the NDIS, plan managers, and NDIS to build the right funding model for your loved one's situation. Families have a choice. Always remember that. Don't let the hospital rush you into any other options. It's now also time for your loved one to start with rehabilitation, with mobilization, physiotherapy, etc. We've seen time and time again families being pressured to move their loved ones into substandard care models, which includes aged care, but you will also find that most aged care and residential aged care facilities will not be able to look after tracheostomy, right? And it's not safe to deal with tracheostomy care or stroke rehabilitation in an aged care facility, or even in a SEAL or SDA facility that is funded by the NDIS. We believe that home care is the best option, but we can also send our nurses into a SEAL or into an SDA that are NDIS funded. ICUs might say, we've done all we can. But if your loved one is still alive, breathing, and has a tracheostomy, there's more that can be done, especially at home, where recovery chances are often much better due to a calm, familiar environment and one-to-one care with staff that you can also select when we go through staff selection. If you're in this situation or you're about to be, contact us now at intensivecaretome.com. We'll help you assess your options, talk to the hospital, and guide you step by step to get your loved one home with the right care in place. Do not let the hospital tell you there's no choice, no hope, because you do have one. Now, with intensive care at home, we are currently sending our ICU and critical care nurses into the home 24 hours a day. We are providing the following: home care services for ventilated adults and children with tracheostomies with critical care nurses 24 hours a day. A genuine alternative to a long-term stay in intensive care or long-term acute care. Tracheostomy care for clients without ventilation. Home care services for patients on non-invasive ventilation such as home BiPAP, home CPAP. Home TPN, which is also known as IV nutrition. Home IV potassium and home IV magnesium infusions, IV fluids, and IV antibiotics. We are providing central line management, PICC line management, Hickman's line management, as well as port management at home. We're providing nasogastric tube and PEG tube management at home. The use of cough assist machines for our clients for airway clearance at home. Palliative care services at home, as well as ventilator weaning at home. We're also sending our critical care nurses into the home for emergency department bypass services. We have done so successfully as part of the Western Sydney Local Area Health District, their In Touch program, saving approximately $2,000 per patient that we keep at home instead of them going to an emergency department. That also means we're in a position to cut the cost of an intensive care bed by around 50%. An intensive care bed costs between $5,000 to $6,000 per bed day. Our service costs between $2,500 to $3,000 per bed day, and we're freeing up the most sought after bed in the hospital, which is the ICU bed. Most importantly, we're improving the quality of life for patients and their families, which is a win-win situation for all stakeholders. Of course, quality of life is much improved surrounded by families and by a team of dedicated intensive care nurses in the home care setting instead of in an intensive care unit. With intensive care at home, we are currently operating all around Australia in all major capital cities as well as in all regional and rural areas. We work with NDIS clients all around Australia, TAC and WorkSafe in Victoria, Department of Veteran Affairs all around Australia. Our clients and we as a service provider have also received funding through public hospitals, private health funds, as well as departments of health. We are having policies and procedures for intensive care at home nursing, and we've built all the intellectual property for intensive care at home since 2012. No other provider in Australia has created more intellectual property when it comes to intensive care at home nursing than we have. This puts us in a position to employ hundreds of years of critical care nursing experience combined in the community. No other service provider in 2025 employs a higher skill level in the community than we do, which enables us to look after the highest acuity adults and children in the community in Australia safely. So if you're at home already and if you're watching this or you're stuck in an ICU long term, or if you're going to hospital and ED all the time and you realize that you don't have the right level of support at home, or if you are stuck in an ICU, I'll give you a real world example today how we can help you. One of our first clients when we first got started in 2012 was a client who was at home initially on a ventilator with a tracheostomy with a support worker model 24/7. Of course, support workers are not equipped to look after a client at home on a ventilator with a tracheostomy. That is dangerous and it's simply negligent. Having support workers looking after a client at home on a ventilator with a tracheostomy is like flying the airplane with a cabin crew instead of the pilot, because anyone on a ventilator with a tracheostomy is at very high risk of medical emergencies 24/7, or even at high risk of dying if they don't have a team of dedicated critical care nurses looking after them 24/7 at home. This is actually evidence-based and is documented in our mechanical home ventilation guidelines that you can find on our website at intensivecarehome.com. Think about it. In an intensive care unit in a hospital, you wouldn't have support workers looking after your critically ill loved one or after any critically ill patient on a ventilator with a tracheostomy. So why would anyone in their right mind do that in a home care environment in the community? So this client at the time found out about us eventually, and the ICU that he was basically living in also knew about us and eventually reached out to us. And we were proving our concept with this client very fast. When we worked with this particular client, we sent him critical care nurses 24 hours a day, and he never ever went back into ICU ever again, as long as we were working with this client. We can do the same for you if you're not safe at home and help you with keeping you at home predictably. Otherwise, we would not be in business. Again, the same is applicable for those stuck in an ICU, similar to this case study that I've just given you. Or if you're going back to ED all the time, please reach out to us. We can help you with taking you through the right steps, including how to get funding with different funding bodies. This is also why we are providing NDIS support coordination. We have a team of NDIS support coordinators, and they have a wealth of knowledge. I've done an interview with Amanda Richards, one of our NDIS support coordinators, and I'll put a link to an interview with Amanda in the written version of this blog. We're also providing TAC case management and WorkSafe case management in Victoria with Lucy McCodder. If you're an NDIS support coordinator or a case manager from another organization watching this and you're looking for nursing care for your participants, please reach out to us as well. If you need more evidence for nursing care, we are also writing NDIS nursing assessments with legal nurse, critical care consulting nurses. If you are a critical care nurse and you're looking for a career change and you want to join a very progressive, dynamic, and high-performing team of critical care nurses in the community, we're employing hundreds of years of critical care nursing experience combined. You can join this high-performing team if you are a critical care nurse. If you are looking for a career change as a critical care nurse, we're currently hiring for jobs for critical care nurses in Melbourne, Sydney, Brisbane, in Albury, Wodonga, in Bendigo, in Geelong, in Warragul, in Victoria. If you have worked in critical care nursing for a minimum of 2 years, pediatric ICU, ED, and you have already completed a postgraduate critical care nursing qualification, we will be delighted hearing from you. I do have a disclaimer though, because we are offering a tailor-made solution for our clients, which includes regular staff. Our clients also do want the same staff coming over and over again because they are so vulnerable and so special. That's why we need regular staff. So if you're looking for agency work where you can come and go, this will not be the right fit for you. We are looking for consistency and our clients are looking for consistency. So please only apply with us if you can give us regular and consistent availabilities for shifts and you're really keen on building solid relationships with us and with our clients. If you're an intensive care specialist or an ED specialist, we also want to hear from you. We're currently expanding our medical team as well. We can also help you eliminate your bed blocks in your ICU and in your ED for your long-term patients, or for your regularly readmitting patients with our critical care nursing team at home. We're here to help you take the pressure off your ICU and ED beds, and in most cases, you won't even pay for it. Even if you do pay for it, it is so much more cost-effective than what you're paying for in ICU and ED, and you get the same level of care. And if you're a hospital executive watching this and you have bed blocks in your ICU, ED, and respiratory wards, or for home TPN, please reach out to us as well. We can help you eliminate your bed blocks very fast. If you're in the US and in the UK and you're watching this and you need help, we want to hear from you as well. We can help you there privately with one-on-one consulting and with hiring nurses privately. Once again, our website is intensivecareathome.com. Call us on one of the numbers on the top of our website or simply send us an email to info@intensivecareathome.com. And if you like my videos, subscribe to my YouTube channel for regular updates for families with intensive care at home and intensive care. Click the like button, click the notification bell, share this video with your friends and families, and comment below what you want to see next or what questions and insights you have from this video. Thank you so much for watching. This is Patrick Hutzel from intensivecareathome.com, and I will talk to you in a few days. Take care for now.